Hello everyone, welcome to Life and Health channel. Yeah, today we have a very important personality in our midst, Mrs. Blessing Onu, who is very excited and happy to share her labor and delivery experience here in the UK. Yeah, she recently had a baby and is happy to share the experience. So, and as we discussed in the previous video, that we'll be talking about episiotomy or tear during childbirth. Yes, episiotomy is a medical procedure whereby a woman in labor is given some cuts in order to make the baby come out faster. Yes. So most places this procedure is really no longer performed in some places. While some other places they still perform it routinely, like for every first time mom. Yeah, why some other places they do it only in the case of complications like case of shoulder dystocia, whereby the head of the baby has already come out properly, but the shoulder gets stuck within the pelvis. In some other places, they do it when the fetal heart rate is not reassuring. So if they are suspecting a case of fetal distress. So these are the few cases where some places still do episiotomy. Meanwhile, World Health Organization recommends that will reduce the rate of episiotomy to as low as 10%. So meanwhile, even if this procedure is not being done, in most cases, for the first time mom, the baby itself gives the mom a very wide tear, which is even worse than the one that is performed as episiotomy. Yes, so this procedure and the either as episiotomy or the incidence of the tear given by the baby is a very traumatic experience, which most women wouldn't want to talk about. So it can go with some complications as well. So depending on the degree of the tear, some can go as far as getting to the anal sphincter, so to the anus, and then it will cause what we call incontinence, whereby the woman wouldn't be able to control how she poos. Yes, and lots more. We don't talk about pains and the rest of them. Most women they can't sit down properly within the first week of delivery because of the tear and the stitches and all the stuff there. Yeah, so anyone that knows anything how this thing can be avoided shouldn't keep anything. You need to say it out to encourage other people and help our women out there. So Blessing will be talking about them today and the possible ways to avoid them. Yes, they are very, very practical and something that is reproducible and doesn't need any sophisticated equipment to perform them. So let's listen to Blessing and see what she has to say. Stay tuned.
Hello everyone. As been introduced earlier, I am Mrs. Blessing Onu. I just had my first baby here in the UK 2 weeks ago. So I await your congratulatory messages. Very important. I am here to give you first-hand information and tips on how to prevent tear or episiotomy in childbirth. A day before my delivery, I was scanned and my baby measured 3.8 kg. I was like, oh my god, I was so scared. Where is this baby going to come out from? Yeah, but as God will have it, gave birth to my first baby without any atom of tear. I have an English friend here who gave me some tips on how to avoid or prevent tear during childbirth. She has 4 children, and in all, she never had any tear. Coupled with my own experiences, I'm here to share with you. First is exercises. I indulge in different exercises, pregnancy yoga. There's one I followed on YouTube, which I will recommend, Leah Cherry, a YouTuber, and different dances. You can start this from your 38 weeks, which is when you are really safe. There's no fear of anything then. From your 38 weeks, this exercises helps to strengthen the pelvic floor muscles. I know it's part of the birth canal, and when it strengthens, it helps to ease labor and delivery processes. And that one, all these the videos and of the dances and the pregnancy yogas have already been uploaded on this channel, so you can follow this link to watch the videos. They are really important. And that one is the perineum massage. It's what's called perineum massage. When you massage the perineum, the skins around the birth canal, the opening of the birth canal, you can either use castor oil, olive oil, or any other natural oil you can place your hand on. So the picture of how to do this perineal massage will be attached on the screen on the comment section here. Another one is not rushing to the hospital. When you start having the signs of labor, you can call your midwife or doctor wherever you're supposed to contact, tell them the situation on ground. Most times they will ask you to come to be assessed, and some will send you back home depending on the level you are. So if it's still at the early stage, I'll advise you labor at home because it helps to ease pressure. Because when you rush to the hospital and it's still far, you end up counting minutes, counting seconds, counting hours, and those time you spend in the hospital will increase the pressure. You'll be tensed up and tends to use up all your strength at that time. Meanwhile, when you really need those strengths, it's doing pushing mainly, and you find out at that time your strength is gone. So when you labor at home, you find that you are more relaxed at home. So when it's more intense, I go to labor, everything will start progressing more quickly, and it will help you to be in control when you are pushing properly, and it helps you to prevent tears. So when you're in the hospital already, I advise you be in upright position. Try to walk around, try to stand. This helps to strengthen the pelvic floor muscle and also brings gravity to work. You know, when you are standing, the weight of the baby tends to go down. So that's what you really need. Then some baby are not engaged at that moment, but when you are already in an upright position, it helps the baby to engage. And those that are already engaged, it helps them to engage more. So also try to use the toilet as often as possible, and this helps provide space, especially when you empty your bladder. It helps to give the baby more space to go move downward, to descend low into the birth canal. Because when the bladder is full, the bladder and the baby tends to be competing for space at that time, and it reduces the length and it increases the length of your labor, because the baby and the bladder will tend to be dragging for space. There will not be free enough space for the baby. But when you use the toilet, when you empty your bladder, there tends to be more space for the baby, and the baby will descend more into the birth canal and eases the time, reduces the time of your labor. And when you are using the toilet, I advise you stand. Do not sit on the toilet seat in case of accidental delivery. But while you are in the labor room, your midwife or your doctor should always be checking you, checking your blood pressure, your temperature, and also how dilated you are. So if they find out that you are not fully dilated yet, then you'll be free to use the toilet, because there will not be any risk of accidental delivery. So, and when you're in the toilet, you can use some hold some things for support if you need to. Yeah. Then when you are in the pushing process proper, I advise the best position for you during this pushing process is to be on your fours. What do I mean by being on your fours? When you have your knees on the bed, then your arms also on the bed, but don't be flat. So if you can tilt they can tilt the bed up for you. You have your knees on the bed, then you lean on the bed and hold it. You can either grab the bed, and this helps you to be in an upright position and brings gravity to work. So when you're in an upright position, the baby tends to move down, and try not to lie in one position for long when you are in the pushing process. Especially, do not lie on your back at all, because this reduces the labor the process, the childbirth process. This reduces it when you are flat, especially on your back. So try, if you want to lie, you can lie on your side, the left or the right side, and try to change position. Do not remain in one position for a long time, because it makes the baby to feel, okay, this is time to relax. But when you keep changing position, the baby also know that no, it's not time to sleep, I have to come out. Yeah. So when you do that, the baby tends to also be active and try to calm down itself. And that thing is warm water compression. So during the pushing process, you can discuss with your midwife beforehand. Midwife used cotton wool and gauze with in warm water to massage the skins around the birth canal. This helps to soften the skin there, and increases the elasticity of the muscles around the birth canal, which helps to reduce the risk of tears during the delivery. Because when the skin around the birth canal is soft and very elastic, you find out that the baby will just move out easily without giving you any tear. Then you have to ask for medication, like pain relief medications. In my own, I was giving paracetamol at first when it was still coming up, then later ibuprofen, but at the intense stage I was giving petidine in the form of pain relief during labor. But it doesn't take off the pain, it helps you to be in control of the situation at that moment. So, and also gas and air, there's one we call gas and air. You smoke it and then you breathe it out through your nose. It also helps you to be in control of everything that's happening at that moment, and which is what you really need to be in charge of the moment. So, and then one of the pain relief again is epidural. I don't advise you to go for that. It's an invasive procedure in which it's being done through the spinal cord. So unless the pain is intense and unbearable, or for other complications, some people use it during CS also to kill off the pain. So you can request for more pain reliefs that you know will work for you better. Now, another one is gradual pushing. So doing the pushing proper, make sure be in control. Don't push, avoid violent pushing. Yeah, when you are pushing, make it gradual. You can take it step by step in stages. Push for some time, then rest, as in you just contract it, push it. When you are pushing like that, the baby tends to, maybe when they say okay, the baby said it's coming, when they are hearing something like that, you allow the hair to come out small, then go in again. It helps to make the opening more elastic, and this is what you really need. So when you continue making it gradual, the baby come out, go in, come out, going like that gradually. When you find out that the final push you give, everything will just go out once, and that is what you will need to help you prevent tears. So when you make it violent, like you want to push everything once, that is the main cause of tears during childbirth. So you have to make it a gradual process to avoid that tear. So this is all for now on how to prevent tears. There are more videos coming, and how to induce labor naturally to avoid violent pushing, and African women pelvis also, and CS abroad. So more videos are coming your way on this channel, so you have to stay tuned. Continue to watch, view, share, comment, especially, and you subscribe to this channel. I believe you will not regret subscribing to this channel. Yeah, and for all the expectant mothers, I believe when you follow all these practices, when you practice all these tips with God, by the grace of God also, it will be a successful one for you. So I wish you all safe and sound delivery, good health of the mother, good health of the baby, and share this video. May God bless you. Yeah, thank you. Bye bye.
Thank you so much, Blessing, for the experience you shared with us. Yes. So I encourage everyone to try this, practice it. One thing Blessing did not mention is that the presence of the spouse or a closest person to the woman in labor is very, very important, because most of the time the woman wouldn't be able to assume this position, especially being on your fours, which is one of the most important thing in achieving this thing we are talking about today. So at that critical stage, the woman is almost, it doesn't know where she is and what she's doing. So you need someone who knows what you want and all your plans to help you and guide you when you start pushing. Yeah, so I advise as well that a husband should accompany the woman to the delivery. So try and share this video, subscribe, and comment, like, so that we'll be able to be getting our notifications for more videos that will come in on how to, keep up to date with life and health issues. Thank you so much, everyone, and see you soon. Bye.